I do want to start with a little bit of skin stuff, but we're going to dive deeper into like the biomechanics, some of the surgeries and stuff too. But especially for those listening, right? We don't get any skin training really. I know for me in chiropractic school, really the only skin training we got was like make sure to look out for melanoma. So going off of what we see at the feet most commonly, we're seeing a lot of calluses. We see a lot of corns, and I think kind of just in general skin lesions, which we know there's some kind of crazy stuff out there. I saw on your YouTube page like cutaneous horns. I didn't even know what that was, but I'd
It's
like for
so
you,
wonky looking.
right?
It's wild. It's like this horn coming out, and you're like, what is this? I remember the first time I saw it in clinic, I was like,
So I would love for you just to dive into like just a little bit of the skin conditions. What are some of the differences there? And then what we should be looking for to be referring out. Like I know especially with corns, they can get really deep, really painful. Those I'm typically referring out. So kind of like give us that overview for what we should be looking for and what we should do.
okay. So let's just start with corns. Corns are interdigital. That's the difference between a corn and a callus. A callus is in for the most part, a weight bearing area.
Okay.
One thing I would say about corn, so it's typically happening with hammer toes. So from your standpoint, I would look at biomechanically, what is the compensation that's occurring? Is it hallux limitus? Is it some type of nerve condition that's creating these hammer toes? And
Mhm.
the result is the corn.
Yeah.
So it's there for a particular reason. So you guys working backwards, from the waist down, what's happening and why. Generally, again, it's a lot of hallux limitus, which I'm sure you notice that is so common and so common to many people. So identifying that and making sure to me that you're correcting the hallux limitus through, your training program or with a custom orthotic to plantar flex that first ray. So we get that range of motion.
Yeah.
Then you don't have to invert the forefoot area so the compensation of the hammer toes doesn't engage. So you're keeping them in that neutral position.
Yeah.
So again, then that's how you mitigate the corns from developing. If you do see this a lot in your practice outside of a biomechanical um, treatment option, I would like have just easy paddings, easy silicone pieces, because these can become very problematic and can affect people to the point where they just don't want to be active anymore. And avoid the chemical based, the Dr. Scholl's stuff. I had to amputate a toe one time because I had a 90-year-old lady who had a corn in between her fourth and fifth digit. And she had put it in there. Of course, she has PVD. The skin is thin and shiny, no hair growth, anything like that. It literally ate down to her bone within 7 days. She came in because she couldn't remove it because it was so painful. She wasn't neuropathic, but she didn't really understand that you need to remove it after 24 hours. So avoid anything like that, especially with that demographic, because it just is happening for a reason. Get to the root of the problem.
Yeah.
Calluses, on the other hand, are completely different. A lot of time that is due to a plantarflexed metatarsal. So identifying that particular metatarsal and offloading it in many different varieties, or even with shoes, you can typically get a lot of comfort with like a Brooks or something like that has the thicker sole, like the Ghost Max 2 would be great for someone with metatarsalgia,
Mhm.
again, from that plantar flex met. Subsequently, then there's the callus.
Yeah.
So then treating it not only from a structural standpoint, but superficially having that ointment on there. The heel is obviously the urea base is what we use to debride away at that dead skin.
Yeah. So the urea is really what's kind of like you were saying, it kind of eats away at the dead skin and the callus, and then the other
Mhm.
stuff is going to help it heal and be
To
more.
hydrate it.
Yeah.
So that callusing. So if you've got that plantar flex met, that excessive pressure, boom, boom, boom,
Mhm.
callus develops. Of course, we can trim it off over and over and over again until we're blue in the face until we address the plantar flex met.
Yeah.
So that's kind of like the internal structural plan, like whatever that's an orthotic, if that's, going through your program. And
I'll
then
go
on the
later.
surface
Mhm.
is using a 42% urea. That is the most effective chemical out there for enzymatic debridement, specifically for skin lesions.
Okay.
And
And
that's the highest strength you can get as well, is the 42%.
cool. So with the shoe recommendation, so when you're recommending the Brooks, because I'll be honest, Brooks are not one of our favorite shoe brands, but
Okay.
that's okay. Right? That's why we have these conversations. So what is it that you're looking for with the shoe? Is it the toe rocker that you like? Is it the cushion? Like what is it that you're looking for there?
Both. The toe rocker for sure, the cushion. So you can get by with more of a minimalist shoe if you have something in there. You could even take an easy power step over the counter insert and cut a hole underneath where
Mhm.
that met head is plantar flexed and
Okay.
allow that to float a little bit.
Yeah.
So you don't have to even do a true custom, but you're 100% right. That extra cushion,
Yeah.
just because they're walking, if you think, you get the five met heads and
Mhm.
they're using mainly the first one, they're
Yeah.
using one over and over and over. I mean, they're just setting themselves up for a stress fracture. So
Yeah.
we've got to more evenly distribute the weight
Mhm.
amongst all five met heads as opposed to just having that one get all the pressure
Totally.
for
Yeah.
long-term success. And barefoot, of course, is going to be awful. You could even carry metatarsal pads, like little silicone pieces, because a lot of people don't want to wear shoes in the house.
Yeah.
So, like a silicone and a piece of cloth that they can take off and on and wash with, warm soapy water occasionally is really helpful for them on the day to day, wearing it with dress shoes, sandals, anything like that. So,
Yeah.
these little things really, from an ancillary revenue standpoint, can really beef up your practice as well. And they're simple things, and people just are like, oh, yes, I need this. I need this. My
Yeah.
cousin needs this. And you're giving them
Tools.
something that they are, you're giving them tools that they need, but you're also able to reap the benefits of your extra time and effort that you're taking with the patient.
Yeah. And the education, right? Like being able to
100%.
communicate, like, this is why this is helpful. And then that also resonates, like you're saying, like, oh, someone else can benefit from this as well, right? So you're helping more people too, which is
Yeah,
awesome.
it kind of ties into that out of the box thinking. I
Mhm.
have so many patients that come in and they're like, my podiatrist keeps trimming it and trimming it. It keeps coming back. I don't have time to go there once a month.
Yeah.
And I'm like, well, you just need this. And they're just, they want to pull their hair out because no one has taken the time to look at the underlying cause.
Yeah.
I am a huge get to the root of the problem. That's why I love your group because I'm learning so much about what I don't know
Yeah.
higher up because you guys are really, really specific and it's fantastic from a podiatrist standpoint. We,
Yeah.
we don't get that in school. Like you don't get
Yeah.
skin stuff. We don't get that to the
Exactly.
level that you teach for
Yeah.
sure.
Well, and that's why I love these conversations because we come from such different backgrounds and such different education, but to be able to share that with each other, right, is like
Mhm.
that's what makes the difference for our patients because now even if, I'm not going to be doing a debridement, right? I know what to expect when I'm explaining it to my patient. So then they come in armed with questions they can ask and kind of a better expectation of that conversation. And I feel like that just in general brings down the worry in our patients too,
Mhm.
right? Like when they have a little bit more knowledge. And so for us to be able to bring that well-rounded approach together, I think is so powerful.
I always love patients that have radiculopathy and it's presenting in their feet, right? Um, that aha moment on their face, and they're like, is that why my left hip hurts? And I'm like, it is. And they're just like, I have seen so many tears and so many like emotional reactions by making that connection because they've been to the orthopedist who didn't even look at their feet to understand that they had hallux rigidus or something on the other opposite foot. And so for them, it validates what they're feeling. And how many times do you hear, I'm not crazy?
Yeah.
So I'm not crazy. Can I take a picture of that x-ray so I can show my husband that I'm not crazy? Because
Yeah.
a lot of people, when they're dealing with pain, they do think it's in their head and everyone's second guessing themselves. So validating their pain and putting it all together is, you just can't get any better than that. And then to see it, it's just amazing.